All right, good afternoon, everyone. Welcome to the Triennial Assessment Office Hours for Local Educational Agencies. This webinar is presented by the California Local School Wellness Policy Collaborative. So I wanted to take a minute to introduce your two presenters for today. My name is Marianne Mills. I am the Program Manager for the CalFresh Healthy Living University of California, and I'll turn it over to my co-presenter to introduce himself.
Thanks, Marianne. Hi, everybody. Good afternoon. I'm Mike Danzig, Nutrition Education Consultant with Nutrition Services Division at the California Department of Education. And just real briefly, I've been doing local school wellness policy work before it was a household name. So I'm really excited to be here with you all today and to review the policy pieces and assessment pieces and so forth. Thanks. Thanks, Marianne.
Great, thanks, Mike. And just a reminder for those of you who are just joining, please make sure that your phone or microphone is muted. We want to make sure we don't have any background noise as we go through our slides. Okay, so before we get into the triennial assessment, I just wanted to provide a quick overview of the California Local School Wellness Policy Collaborative. So we are a group of 25 plus organizations at the state level that are really committed to improving wellness and academic success. The vision of the Local School Wellness Policy Collaborative is to inspire school communities to take their wellness policies from paper to practice. And the mission is that we are a catalyst for school communities and stakeholders to implement highly effective local school wellness policies in California and to help support student health and academic achievement. We did post our website on the slide, and it's also in the chat if you want to learn more about our collaborative and view some of the resources we have available to our local educational agencies. So now that we've introduced ourselves, we want to get to know you. So if you could take a moment to share in the chat where you're joining us from. So what is the name of your school district or organization? And one thing that you're hoping to learn today. So what are you hoping to take away from today's presentation? And I'll start reading out some of your answers as they come in. All right, looks like we have Carlsbad Unified School District looking to learn how to ensure they complete their assessment fully and accurately. That's a great goal. Hopefully we can help answer your questions to get you there. We have Whittier Union High School District, understanding the whole triennial assessment and very behind, and that is okay. Wherever you are is okay. We're just here to provide some support. We have KIP SoCal, brand new to this, so wanting to learn all of the things. Great, you're in the right place. Looks like we have San Bernardino County Superintendent of Schools, wanting to know how best to support their school districts in this process. Barango Springs Unified School District, how to get buy-in from their partners to participate in the school wellness policy collaborative or in their collaboratives at the local level. We have Lodi Unified, hoping to see some assessment tools. That's perfect. We'll definitely have some tools to share with you today. Riverside Unified School District, like to gain confidence in working with schools to collect compliance. Great goal. Calaveras Unified School District, ditto to all of the above. Perfect. We have Clovis Unified, really wanting to understand how the triennial assessment works. They're new to this. Perfect. Vista Unified School District, really wanting to learn the ins and the outs of the assessment. We have San Bernardino City Unified, wanting to know more about how to complete the assessment and any state mandates. So we'll be covering that as well. Chawanaki, I hope I said that correctly, Unified School District, new to the position and wanting to just understand all of it. Okay, great. I'm not going to read all of them, but thank you so much for participating. We're really excited to have you here today and hopeful that we'll be able to answer your questions around the triennial assessment and help you feel better equipped to complete this process. Okay, so just wanted to provide a quick overview of the agenda. It's quite simple. We're going to provide a quick overview and review of what the triennial assessment is and what to kind of expect from us at the state level. And then we're really going to dive into the triennial assessment and the different components. but the primary purpose of today is to answer your questions. So we have lots of time built in to answer your questions, and a lot of you submitted questions in advance of today's webinar, so we'll be answering those live as well. So hopefully we'll meet the goals and the objectives that you set for us today through this process. So I'm going to turn it over to Mike to provide an overview of the triennial assessment itself.
Great, thanks, Marianne, and again, welcome everybody. Good afternoon. It looks like there were a lot of folks that are, I would say maybe not a lot, but there are quite a few folks that seem to kind of be new to the whole process. So welcome, welcome. What I'm going to take my time to do is just kind of give you just a brief overview of the assessment, again, which will hopefully give you sort of a footing to either better understand or re-understand the intent and the benefits of the undertaking of completing a local school wellness policy triennial assessment. Go next slide. So some of you may have seen or participated last October. We did a wellness policy webinar to go through the triennial assessment template that's on the collaborative's webpage, which I believe was posted in the chat and maybe reposted again. But that training is actually recorded, and you can go through that whole training on your own at your leisure as well, besides the information that we will provide to you today. So some of this is very similar to that. And but it'll just sort of be more briefly stated today before we get to your questions. And I just wanted to go over what is the triennial assessment, why it's required, why it's important, who must complete it in the district, how the district should utilize it for their own use, as well as when the state comes and asks about it. And then finally, the timeline to complete it. And then I think we'll shift over to the office hours portion, or Marianne will actually introduce a few other pieces, and then we'll switch over to the office hours portion, where we will go through some pre-submitted questions and answers, and then allow more time for you all to ask any additional questions or follow-ups that you may have. Okay, next slide, great. So what is a local school wellness policy triennial assessment? It is a mouthful, but in a sentence, I would sum it up to say it's a comprehensive tool to help your agencies evaluate your wellness policy. Why is this required? In 2010, at the federal level, Congress passed what they call the Healthy Hunger Free Kids Act, which is probably, again, more of a household name for you all today. And this act, or this law, required the U.S. Department of Agriculture to develop rules for each stage of a district's wellness policy, including the development of the policy, implementation, evaluation, and ultimate revision as necessary. And the triennial assessment is really the evaluation arm of this process. And why is it important? Well, I think we can all agree that it's difficult to make change unless the changes are measured, evaluated, and analyzed. So the triennial assessment is really a means to understand the district's wellness policy and how it was implemented. And then this information can be analyzed to determine next steps for continued improvement of the health of the school environment, whether that be change the language of your wellness policy, change up some of your implementation strategies, and so forth. That's what this evaluation kind of helps you all do. And so who in the agency is responsible for this wellness policy triennial assessment completion, as well as the policy overall? Because of the various facets of a wellness policy, it's really designed to be a district-wide responsibility. And I usually like to repeat that in my trainings. It is a district-wide endeavor. While many cases it falls to food services, in many districts, they're the ones that have been charged with kind of leading and even maybe carrying out the components of the wellness policy. But in my, and I think our experience, it truly can't be successful unless all areas of the district are able and willing to be part of the wellness policy process, because this isn't all just food and food services initiatives. The wellness policy covers many other aspects of wellness and health that don't include just nutrition. There is a requirement that there must be someone with oversight authority to ensure that the policy goals and plans are followed through. And that person, or at least the position of that person, should be highlighted in your actual wellness policy. But what we also find is this person usually isn't the one involved in the day-to-day actions. What we usually find is this person is the superintendent or maybe the assistant superintendent. They may be involved to some degree, but they're not usually heavily involved, again, in making sure that the day-to-day workings of a wellness policy get implemented and evaluated and so forth. Usually that falls to what we sort of term a wellness coordinator or a wellness committee lead. And in addition to that person, it's also the wellness committee members. And those members should be a representation of your district, school, and community. And really what we look at is these are the folks that are kind of the boots on the ground, if you will. They are the ones that will develop, share, and carry out the implementation plans, bring in other folks as necessary, alert administration as necessary, even the school board is necessary, and so forth. So it's really these wellness champions at the district that will also complete the triennial assessment, share it out with their agency and their surrounding community, and then follow up with the revising of the policy and plans accordingly. Okay. So recall that there are 3 components to the wellness policy triennial assessment. First, there is the component of comparing your policy to a model policy. And the purpose of this exercise is really for your agency to be able to see what language and strategies it may potentially want to include either now or in the future. It's really to help you sort of stretch your thinking about where you want your district to go. And they call them model policies because they usually have additional information or language that kind of goes above and beyond just the basic requirements of the policy itself. The second part of the triennial assessment is measuring your progress your agency is making in implementing its goals successfully. Again, this allows you to determine if you're on track with what you said you would do, that's spelled out in your policy or accompanying documents, and then allows you to pivot or make changes as necessary at various intervals in time. Again, all dependent on how you and as things are working in your district. And lastly, the third part is to what extent are your schools complying with the tenets of your policy? Again, this allows you some more quantitative results. And for example, if your policy states that foods will not be used as a reward, quantitatively in your district, how is that working? How many classrooms are not using food as a reward, and so forth? Excuse me. So that's kind of the 3 tenets. And then the last one on the slide is really the reporting to the public, which is another requirement. So not only do you need to, but you really, again, it works to your benefits to be able to share your successes of the assessment and what's going great in your district, but it's also good to share what the challenges are, because again, in order to move forward and continue to create healthy nutrition or healthy school environments, you have to be able to figure out what those challenges are and try to put strategies in place to overcome them. All right, this is always an important question that folks want to ask is, what is the state's role in this process? And really kind of, when I say the state, I mean the California Department of Education in nutrition services where I work. So I have a number of colleagues who are in our field services unit, and they're the ones that go out and do what we call administrative reviews. Some people call them audits, but we like to call them reviews. We're kind of like the IRS, but not like the IRS. We won't just come out and tell you, things that if we find things that are incorrect, we're just not going to tell you what those are. We follow up with that by providing you the technical assistance and training necessary to resolve them. So that's why I think we like to call ourselves reviewers versus auditors. So the U.S. Department of Ag, USDA, they authorize each state to be that monitoring and enforcement arm, as well as the technical assistance arm for the entire administrative review. It covers way more than just the local school wellness policy, but that's sort of what the state's role is. So in regards to the wellness policy, we're just there to ensure that the requirements are met. And again, we call that an administrative review. It usually occurs through your food service department every 3 to 5 years. We ask overarching questions regarding the wellness policy, including the triennial assessment. For example, we'll inquire when the assessment was completed, but we will absolutely not scrutinize its contents. That is really, those are district level issues right there. So, you know, we don't know what's best for your district. You only know what's best for your district. We just want to make sure that those overarching goals have been met. So really my take home message here is for districts to focus on using the requirements for your benefit, not just to complete this work to check a box to show us that you have completed it. Okay, so what will we ask during the administrative review? There are a certain number of set questions that the USDA requires us to ask. And again, you'll notice as I kind of review them, they're very sort of broad and overarching. But they consist of, and I think these are almost verbatim, please explain how the required elements of the policy are being met. How does the public know about the wellness policy? Who's involved in reviewing and updating your policy? What is their relationship with the school food authority? Excuse me, when and how does the review and update of the policy occur? How are potential stakeholders made aware of their ability to participate in all aspects of the wellness policy? We will ask you to provide a copy of your most recent assessment on the implementation. And then lastly, how does the public know about the results of your most recent assessment? So as you can see, the state doesn't ask detailed questions. They just sort of ask some general questions about implementation and progress. And again, as I stated before, the details are to be utilized by you at the district or your agency to, again, ensure a successful, healthy school environment and working towards that. Okay, timeline. This has kind of been a moving target, but I'll kind of just summarize with the fact that the USDA over the last couple of years has released waivers to allow districts to opt in order to extend their deadline, if you will, or the completion date, if you will, of the triennial assessment. So agencies that did submit a waiver last year have until this June 30th, to complete their assessment. If an agency did not submit a waiver, ideally they should have had their assessment completed already, and we'll kind of go into that, what that means a little bit, whether you do have it done or not. Excuse me. A couple of things is that just remember that you do not need to submit your assessment to us in any form. Again, we will inquire about it at your next administrative review. And if you recall, that's every 3 to 5 years. So your review may be coming up this school year, or it may not be for a few more school years. But either way, at your next review, we will be asking either about your most recent and potentially maybe even both assessments if it's 5 or so years out. So with all of that said, and given the current environment and all the issues we have come with the pandemic, we realize and understand many districts, regardless of waiver status, may be working on their assessment but have not completed it yet. So in general, I'll say this on this slide and I'll say it again in a few more slides, but just do your best with what you have right now. We absolutely understand that we are not in an ideal situation. So we would just recommend that you meet with your wellness committee to the best of your ability, develop a plan for how best to complete this triennial assessment on or as close to the date of June 30th as you can. But really, what we really want to emphasize is that because the data is important for you all to move forward, that's more important, I think, than a sort of an arbitrary deadline. I'm not going to tell you not to have it completed by June 30th, but I will say that do the best you can up until that date, and you can continue working on it. If you still need to gather data from teachers or from school environments, do that, because again, that will just help you down the road when you want to review your wellness policy for any changes that you see need to be made. Okay, so this is my very calm Kumbaya slide that we recognize every agency will be at their unique place in this process, and it's okay, like Marianne said earlier, it is okay wherever you are. We understand and acknowledge the impact of current events, and we know you all do too. We encourage you to do the best with the resources that you have, but we do expect at least for you to have a plan of action to know where you want to go and what you want to do. Also, remember to be realistic. Again, this is a marathon, not a sprint. You don't have to do everything all at once. Even though that sounds great on paper, we all know that in practice, it's a most difficult thing to do. So the best advice that I can share is just to continue to engage and educate your entire district and community on your wellness policy and its goals. Obtaining interest and commitment at the top continues to prove to be a top priority strategy. And as I stated earlier, again, as I'm sure you are all aware, without district administrative support, it's very difficult to steer this wellness policy ship, or any ship for that matter. So just to kind of summarize and prioritize from the prior slide, excuse me, just like we will be comparing, a policy, or no, sorry. What we really want to focus on here is, again, commitment at the top. I've emphasized before, and I'll emphasize again, those districts who have district level support are more successful, just overall, and for a variety of reasons, which you can probably understand. Also strive for a common understanding at all levels, continuing again to engage and educate parents and other community members and district school staff, teachers of this work and why it's important. Will help them along, instead of just saying you can't serve food in your classroom anymore. That education part is very, very important about the whys, bringing teachers along, just as an example. A wellness committee leader that has time and resources to devote to this process. The ideal wellness committee lead is one that is actually hired just to do that job in the district. And we know of many districts who have done that already. In addition, a comprehensive wellness committee made up of all facets of the district, the school, and community. Again, bringing a diverse group along, including those affected by these changes, such as students. Ensuring parental input into the process. It only strengthens the final product when you get that buy-in up front. And finally, since the actual work occurs really at the school site, that's where the change needs to occur. Identifying a strong and connected site leader for each of your school sites, and as well as a small group of very dedicated parents or whomever at that school site to do the work of the gathering and the educating and so forth. So while I encourage you to complete your triennial assessment as best you can to meet the deadline, again, I encourage you to continue on with the work. If you don't feel like it's enough information for you to kind of understand how to move forward or what to do next, continue gathering that information, having those conversations with your school board, with your wellness committee, with your principals at their meetings, your PTA folks at their meetings, to best figure out how to move forward in your district. Okay, remember that an assessment is really an ongoing project. It should start on day one. So that's my summary. I saw a couple of questions come in, but I just kind of wanted to stop for a minute and just see if there was any particular questions about the information that I presented. There is a lot more coming. So some of your questions that you may have now may be answered in some of the future slides.
Mike, I don't know if you
go
can
ahead.
see the questions. I was going to maybe read them for you. Somebody typed in what would be some examples of potential stakeholders for the school wellness committee?
Great question. So and we can get this information to you. So the actual rule within the USDA regulations spells out a number of different categories, if you will, of folks that you need to invite. Okay, they don't have to necessarily, they're not required to participate, because I think we know and the USDA knows you can't force somebody to participate. But what the requirement is, actually, what the actual requirement is in your policy, you should have a description of how you're going to reach out to various audiences. And it lists quite a few: parents, administrators at the district level, administrators at the school level, teachers, students, and so forth. So again, what the rule is you should be able to describe how you've reached out to those folks. Have you gone to their meetings? Have you sent emails out to them? And so forth. We can get some more detailed information about who that is, but really what you're looking for is a very well-rounded group of folks from the aspects of the various areas that your policy is going to cover. It covers PE and PA. You should have a PE person on there. It covers nutrition. You should have a nutrition person on there. If you're going to be looking at social and emotional wellness, you should have some of your school or district counselors on there. So that's sort of how that goes.
Great, thank you. Okay, the next question is it confirmed that the administrative review is every 5 years instead of 3 now?
It is not confirmed. That is still something in the works. I know, and I probably know enough about that to get in trouble. But what I do know is that what California has requested by the USDA in the past and has been accepted is that we can delay some of our administrative reviews into the next year. I think we're coming to the end of what we've asked for and what we've been accepted on. So I'm not exactly sure how we're doing moving forward. Sorry for that kind of answer, non-answer.
So the answer is it depends, right?
Right.
Our favorite answer. Okay, Ozma asked, which surveys are best to use? The school health index or site level questionnaires? Go ahead,
Yep, I think that's okay. Another great question. And again, it's hard for us at our level to determine what's best for you. I will say that surveys and assessment tools that are already created have their own benefits. They're already created. You can pick and choose from them how you want to implement and what types of things you want to implement from them. That's one of their benefits. But they may not meet your specific needs depending on what those needs are. So in some instances, maybe a 1 or 2 or 3 questionnaire supplement that you put into a teacher's box might work better. So again, it's really hard for us to kind of determine what works best for you all until you kind of do some of that analysis on your own policy and what you want to do.
And I'll just add to that in the next segment, I'll be talking about the Triennial Assessment template. And we do identify a few different tools that you can use for your assessment. And we provide kind of pros and cons of each to help you determine what might work best. It is not an exhaustive list, but it's a good place to start if you're not entirely sure which assessment or which tool makes the most sense for you and your team. So I'll share the link to that shortly, and we'll look at the template itself quickly. So that could be useful. All right, Alana asked or commented, our health and wellness looks more like social, emotional, and mental health right now and less focused on nutrition. I appreciate you saying you recognize the time we are in and want to ensure that this is okay.
Absolutely. Again, there are so many things that you could potentially focus on. And what we want to make sure that we convey is that you focus on the pieces that are most relevant to your district and those that have, backing or acceptance of that. So if social, and I think you're not, you're absolutely not an island out there in regards to social and emotional health. There are a lot of districts focusing on that right now. And that's a big chunk of wellness. It's difficult to get all those pieces together. So if that is what you want to really focus on and move forward on right now, then that's the focus, and that's the flexibility of what this policy work is about, is that you can focus on those things specifically.
Okay, we have another question. It's very specific and very long, so I'll try to summarize it. But essentially, I think the question is if they cite specific codes or regulations in their wellness policy, and it addresses required wellness policy language, and they're completing the WellStat scorecard, would they give themselves full points? So for example, in their policy, they state the district shall adopt nutrition guidelines, which are consistent with X, Y, and Z codes and federal regulations in which support objectives promoting student health and reducing childhood obesity. So would that language cover them in the standard of assures compliance within the USDA nutrition standards for reimbursable school meals?
Again, a great question. I know WellStat's kind of set up, this is a very, very interesting question, because WellStat's sort of set up to be very direct with their language. I would say that the point system isn't as, at the end of the day, the point system probably isn't as important as how this information gets conveyed to all the various audiences. So for some audiences out there, I think this will be understandable, but for others, it probably is a different language. So just think that through. So if there are specific areas within those United States codes that you maybe want to pull out and be more specific on, that may help your parent community better understand your wellness policy goals, you might want to kind of consider maybe some of that.
Great.
I think it's at least 1 point.
Yeah. Okay. And then Alana asked, can we use data from the California Healthy Kids Survey to help with the triennial assessment as well?
Absolutely. Yeah. Again, information that tends to be gathered already if your school or your district already does the Healthy Kids Survey. So yeah, if it's already done, and I don't know who does it in your district, but if it's not the wellness committee, which it probably isn't, you already have data at your disposal to utilize. So yeah, it's great.
Great. Okay, I think that wraps us up with questions around, the general triennial assessment overview and process that you described so well, Mike. So thank you. If more questions come up, feel free to type them into the chat box and we'll address them. We have kind of stopping points throughout the presentation to solicit questions and do our best to answer those. So keep them coming. All right, we are going to move on into the actual triennial assessment process. And again, really focus on the questions that you have and ensuring that you feel equipped to move forward with completing your triennial assessment through our answers. So we wanted to start by launching a quick poll just to understand where you are. So has your district started completing the triennial assessment? The options are yes, no, or I'm not sure. And there are no wrong answers here. We just want to hear from you to get a sense of where you are in this process. So you should see a poll pop up on your screen, and we'll give you a few minutes to answer. This will help us kind of understand where you all are and adapt our presentation accordingly. Looks like just over half of you have answered so far, so keep these answers coming. Okay, we'll just give it a couple more seconds. 40 people have answered. We've got about 60 folks on the call, so looking for a few more answers before we close the poll. All right, looks like responses are slowing down, so we can go ahead and end the poll and share the results. So it looks like we're pretty split. So 20 of you have started completing the process, so just about half. 16 of you have not started yet, and that's okay. And 6 of you aren't sure if you've started or not. So again, no judgment, nothing wrong with any of these answers. We just kind of want to understand what we're dealing with today. So thank you for participating in that poll. Okay, so I wanted to reintroduce you to the Triennial Assessment template. This was created by the California Local School Wellness Policy Collaborative and is really intended to guide local educational agencies through the entire triennial assessment process. It includes a lot of background information, important information, as well as templates to help you complete the different requirements and examples. So this tool has been on our website since about September, October. So hopefully some of you have seen it before. If not, that's okay. We just added the link to the chat box. So feel free to click on that link and check it out while we're presenting. We'll also be sending a follow-up email to participants with the direct link so you can access it that way. But as Mike mentioned, the triennial assessment is comprised of those 4 required components, and I'm going to go into each of those in a bit more detail and then answer your questions about the individual components as well. So as you can see, and a reminder, it is the triennial assessment is comprised of those 4 components. So the first is the comparison to a model local school wellness policy. The second is the extent of compliance for all schools with the wellness policy. The third is progress made in reaching local school wellness policy goals. And the last is the triennial assessment report to the public. And again, the template provides tools, resources, tables, examples of how to complete each of these 4 components. And I'll be walking you through them as well today. So before you even begin your triennial assessment process, as Mike mentioned, this is a group effort. It should not fall on the shoulders of one person. So we really recommend that before you even start, for those of you who haven't started yet, that you really connect with your school wellness policy partners to ensure that they're even aware of what it is and can understand how to support you. If you don't already have one, we really recommend creating a district wellness committee. Again, this should not be a process that is completed by one person. It takes a village. So we really recommend getting a group of wellness champions together to assist in completing the triennial assessment. And we know sometimes it's hard to, gather folks and solicit support for this type of work. And so we really want to focus on emphasizing the benefits of completing this for your school community. So for example, we saw someone earlier mention that there's a lot of momentum right now around social emotional learning and mental health. And the triennial assessment can be a great way to assess how your schools are doing in reaching their goals around social emotional learning and mental health. So it's really about kind of finding where people are and finding out what motivates them and connecting your goals to their goals to complete this work together. Okay. So let's start by taking a dive into the different components a little bit deeper. So as I mentioned earlier, the first component is comparing your wellness policy to a model wellness policy. And really the purpose of this component is to identify strengths in your written wellness policy, as well as opportunities for improvement, and then really to see how you might be able to strengthen your written wellness policy. The California Local School Wellness Policy Triennial Assessment template provides example model wellness policies. It also provides an overview of the different model wellness policies and the pros and cons of each to help you select the model wellness policy that makes the most sense for you. And then we also have comparison tools where you can plug in the language from your wellness policy and compare it to the model language and identify areas where you might want to adopt stronger language into your model wellness policy. So to complete this component, we recommend gathering your wellness committee together so that you can complete this wellness policy as a team. Complete this comparison as a team. As a team, we recommend you selecting a wellness policy that makes sense for you for your comparison. And then complete the comparison using the tools in the template. So again, there are tools available on the Triennial Assessment webpage, and I'll show you what that looks like at the end of this presentation. But like I said, there are tools where you can plug in your language, compare it to a model wellness policy, and kind of write your assessment. So this is a really good way to have everything in one place. And then after that, we also created tables to kind of summarize what you learned and what you adopted. So we created the model local school wellness policy comparison results table, where you can, again, it's kind of a high level overview of what you accomplished in your comparison. And that's an example of something that you could share during your administrative review with the Department of Education. And if possible, adding new language to your wellness policy based on your assessment is really the ideal, right? So this is kind of what we're working towards, is how do we continue to strengthen the school wellness policy through this comparison process. Okay, so before we began this webinar, we did send out a survey to folks to gather questions in advance. We wanted to make sure that we had answers for you and all of the questions that you have. So what we've done is added those questions into this presentation along with our answers. So hopefully these questions are questions that you've had, and the answers help kind of provide some clarity for you. So the first question that we received around the model wellness policy comparison component was, how do we access a model wellness policy, and what are other model policies districts can compare to? And our answer is that we have example model wellness policies available on the Triennial Assessment webpage. And actually, I'm just going to open this up right now so we can look at it together. So this is what the Triennial Assessment template webpage looks like. At the top, we have our introduction, and then we have two different options. So you can download the full template, which is just a Word document that you can use, and you'll see it pops up as a little download, or you can go through each of the components on the web page. You can click on each different component to get to where you need to go. So if we look at component 1, which is where we are now, you'll see there are different examples of model wellness policies, descriptions of each of the different model wellness policies, and then links to the comparison tools, which is what I mentioned earlier. They're basically an Excel document where you can plug in your language and compare it to a model wellness policy language. So here's an example. So you add your language here, look at the existing example language, add your comparison and analysis, and any next steps that you identify. So we have these comparison tools available for a variety of different model wellness policies, and you can choose which makes the most sense for you. All right, let's get back to our presentation. Okay, so question number 2. Can districts compare their policy to other district wellness policies in the region, or does it have to be the Alliance policy? And so the Alliance is an example of a model wellness policy. And our answer is yes, absolutely. You can identify model wellness policies that work best for you. There is no requirement from CEE or from the California Local School Wellness Policy as to which model policy you choose. We do provide examples, but you are not required to use a specific model policy. Okay, so those are the 2 questions we received in advance around component 1, which is comparison to a model wellness policy. Please type any other questions that you have around component 1 in the chat, and we'll do our best to answer them as they come in.
Thanks, Marianne. We do have one question so far. And this question is comparison with 2 model policies good enough, or should we do a comparison with all the model policies? You want to take this one, or you want me to take this?
I can take it, but feel free to chime in. 1 policy is plenty. So comparing your policy to a model wellness policy is all that is required, and that is sufficient. If you choose to compare it to more than 1, then you're going above and beyond, and that is great too. Anything to add to that, Mike?
Perfect answer. Just remember what the purpose of it is just to be able to look at other types of model policy to potentially add to yours.
Any other questions around component 1, which is comparison to a model wellness policy? While those questions are coming in, I did want to show you the model wellness policy comparison results template. So it's a very simple table Word document where you basically just summarize what you did and what you found. It's literally one page, and you can complete this. And this is a great example, again, of something that you could share during your administrative review as kind of evidence that you completed this component. We also provide a sample completed table for you to kind of use as a guide if you're not really sure what kind of information to include. So again, all of this information is on our Triennial Assessment webpage and available for you to download and edit and add your information to it. Okay, I'm not seeing any other questions around component 1, so we'll move on to component 2. Yes, so Alana asked, and we don't send this table to anyone, right? Just to keep for our records. That's exactly right. So you're not submitting any of your triennial assessment documents until you receive your administrative review, and then you can share your documents with the California Department of Education when they come to you. Anything to add to that, Mike?
Nope. Again, these are, for your use to move forward. I mean, these are things that you might want to share internally, maybe with your school board, so forth, to kind of back up your rationale for why you want to make changes.
Perfect. All right. We will move on to component 2, but if you have other questions, feel free to type them in the chat and we will make sure to answer them for you. So component 2 focuses on the extent of compliance for all schools within the local school wellness policy. So this is really looking at the school site level and whether the policy is being implemented as it's written. And so that's exactly what I said. So really the purpose of this is to really determine whether schools are following the wellness policy. And if not, again, no judgment, just this is a good opportunity to identify where additional support might be needed so that they can implement it and are in compliance with the written policy that you have for your school district. It includes, the triennial assessment template includes methods of assessment that you could use for this component. And so we have examples of, things like surveys and other assessment tools that you can use. And the template, again, that I can show you on the website includes links to existing assessment tools that you can use to complete this component, as well as another template for you to complete, which kind of shows how you measured extent of compliance and what you discovered. I can show you what that looks like in just a moment. So how to complete component 2. Again, you're going to want to work together as a team with your wellness committee to really determine which method makes the most sense for you and your team and your schools to measure compliance. Once you've identified your method, we recommend recruiting school site partners to assist in completing the assessment. Because this is done at the school site level, it's really helpful to have champions at the individual school sites help complete the assessment. And so some examples of partners are teachers, principals, students, parents, who really understand what's happening at that individual school site and can provide an accurate assessment of what's happening around the school wellness policy at that specific site. And then once you've recruited your school site partners and they've completed the assessment, you want to gather all of that information and compile the results kind of at the wellness committee level. Again, we provide an extent of compliance table, so you can complete that and provide the information that you've learned from your assessment in that table. And that's another example of something you can provide to the Department of Education during your administrative review to show that you've completed this requirement. And then last is really share the results with your committee. So what did you discover? Again, where are some areas where you might be able to provide support? Where are some best practices that maybe you could share with other school sites that, kind of model what you're wanting to see in terms of wellness policy implementation? Okay, so one of the questions that we received in advance of the webinar was, I am new to this position and don't know where to gather this data. And that's completely understandable. And so again, we'll refer you back to the Triennial Assessment template because it does provide guidance and resources on where and how to gather this information. The next question we received was, does the assessment simply review the policy or does it review actions? This is a really great question. So this portion of the assessment is actually looking at actions. It's looking at implementation of the wellness policy at the school level. So the first component is looking at the written policy. This component is looking at implementation. So it's really looking at the actions. The next question we received was, what about distance learning programs? Do they need to complete this component? And the answer is yes. So any local educational agency that participates in the National School Lunch Program must complete all components of the Triennial Assessment. The next question we received was, who completes the assessment of schools? Does it have to be an administrator, or could it be a school health tech or a kitchen manager? And what do you do if no one has time? So our answer is school assessments can be completed by any member of the school community who have that information. So I mentioned this earlier, but you can consider teachers, parents, students, a school health tech, a school nurse, a principal, honestly, anyone who is willing and knows the information being asked in the assessment. And oftentimes you'll have to kind of ask multiple people, right? And we really recommend, where possible, if your school sites have school site councils, they're a really good resource to complete the assessment. Okay. So please type any questions you have about component 2 into the chat box, and we will answer them as they come in, but it looks like we already have some questions that came in.
Yeah, it looks like a couple of questions came in about part 1.
Okay.
So the first one was, does it need to be shared with the public? And maybe I can answer some of these if you'd like me to.
Please do.
So in general, I mean, the USDA requires that the triennial assessment results be shared with the public. How you do that is up to you. You don't necessarily have to share the details of each component of the full triennial assessment, but you can kind of pull things out from it, highlight them, and then, but you always have that data as backup or background in case somebody asks for more detail. Next question is, if we're not submitting anything, how are we held accountable for the June 30th deadline? Great question. I will back up a little bit and say that during your administrative review, if it's found that you have not completed it, the recourse, if you will, is we would require you to create a plan for how you're going to complete it. And that's all we would do. We're not withholding funds, or we're not taking away funds or anything like that. All we're doing is saying, okay, we understand that you have not completed it yet. Please share with us a plan on how you're going to do so. So if this June 30th date comes and goes and your administrative review is this school year or next school year, you kind of have that time to do some more investigation, some more research, some more data gathering. As long as you can show that it's completed before your next AR, there isn't anything that we from the state would be able to do. Let me also say that your administration may or may not agree with that. Your administration may want you to get it done by the June 30th deadline because that is the deadline. And again, that's absolutely acceptable and understandable as well. The next one is, to confirm understanding, we don't need to send the triennial assessment to the CDE by June 30th, 2022. That is correct. Next, we can send the survey to a bunch of stakeholders to complete on their own time, correct? Absolutely. If those stakeholders hold key information that you need, that's the best way to do it, is to send that information out to them and have them return it. Do you have something, Marianne?
I think that the survey is a really good idea to gather information efficiently. So we do mention that as a recommended tool to use to gather the information that you're looking for around implementation. So Alana, you're right on track with that thought.
We were asked if we'll receive a copy of the slide deck, and thank you, Bailey. she posted yesterday that we're recording this, so this will be available to everyone on the collaborative web page after.
And sorry, just to add to that as well, we are going to be putting together a frequently asked questions document that we'll also post to the web page so that you can find these answers quickly and you won't have to go through the slides or the recording to find them.
And then the last question we have so far is there a certain number of stakeholders we should gather survey feedback from, or just as many as possible? I would say, again, it's probably focused depending on what information you want to gather. And I'll go back to that example that I used about using food as a reward. You definitely would want to reach out to your teachers, potentially your school administrators, maybe even some parents if they do a lot of volunteering in the classroom, to kind of get an idea of what the classroom experience is and whether that is happening. But then, again, when you think that through, there's probably folks that you wouldn't reach out to for that specific question. So again, kind of think through what you want to ask and who those audiences that you need to gather data from.
And I did receive like a private chat with a question, but I think I can ask it out loud and we can answer it. Does this information need to be shared with the public? So the answer is yes, to a certain extent, right? One of the components of the triennial assessment is sharing the results of your assessment with the public. So you don't need to share everything. We recommend kind of a high level overview of what was discovered during the triennial assessment process. Anything to add to that, Mike?
Yeah, so I guess when you're thinking about which audience, when you present, say, to your school board, you're going to want to offer them a different look, potentially, maybe share different information with them than you would, again, maybe a PTA meeting or even a school site meeting. So again, think that through. What kind of data would your school board like to have, need to have? What kind of data would you like to share with your community members? And again, the look can be very, very different.
Great, thank you. And so before we wrap up component 2, I just wanted to show you what it looks like on the web page. And again, there's also a Word document that you can download that looks basically exactly the same. But so it provides you with kind of an overview of this requirement and examples of different types of assessments you can use. And as I mentioned, a survey is a really great example. There are other existing tools that we provide that you could use to assess compliance. And then again, we have a table that kind of summarizes the information that you gathered that you can complete. It's relatively straightforward. And this is, again, an example of something you would share during your administrative review to show that you completed this component. And again, we do have a sample completed table to help you kind of gain an understanding of what you would want to include in this table. Okay, so let's move on to component 3, but keep your questions coming. Okay, so as Mike mentioned, component 3 is really assessing the progress made in reaching local school wellness policy goals. So one thing that I wanted to note is that the final rule, which is the USDA's rule on local school wellness policy requirements, encourages local educational agencies to essentially create an action plan, which includes specific goals. So this is really at the district level. Your wellness committee is encouraged to create and identify goals within their wellness policy. So the purpose of this component is to really document progress and demonstrate that the local school wellness policy is being implemented. But really the purpose is to show that you're making progress in reaching the goals that you as a district wellness committee made. So the local school wellness policy triennial assessment template includes, again, links to recommended tools that you can use to measure progress in reaching your goals, and again, progress in reaching goals template. So again, we have tools and resources to help you complete this component. And just wanted to provide an overview of steps you could take to complete component 3. So again, work with your wellness committee, or you shouldn't be doing this work alone. I know we say that a lot, and I know it's hard, but we really recommend that you involve other stakeholders in completing the entire triennial assessment. So if you don't already have an action plan, that is okay, but we do recommend that you pull your wellness committee together to create an action plan and develop clearly defined goals for your local school wellness policy. Once you've done that, we recommend selecting a tool from the triennial assessment template to assess the progress that you've made in achieving those goals. Then complete the assessment to see kind of where you are in your goal completion. And then complete the progress in reaching goals template to again kind of document what you discovered. And again, this is a good resource to share with the Department of Education during your administrative review to show that you've completed that component. So some of the questions that we received in advance, this is the first one. We are a large district and I have a difficult time receiving responses from principals regarding their compliance with the wellness policy. So how do I receive more responses? The answer to this question is really try finding other champions. You don't have to go through principals. As we mentioned, some folks that we've seen be successful in assisting in the past are teachers, school nurses, community organizations that work in your schools, students, parents, really anyone who is considered kind of a wellness champion at the school to complete that assessment. And I did want to note that actually I'm realizing now this question should have really gone in with component number 2, where you're looking at the individual site implementation, not necessarily the broader progress in reaching goals at the district level. The second question we received is, can your school complete a Google form to fill out this information? And the answer is yes. And actually, Mike, I'm about to cough, so if you could take over.
All right, Marianne, go for it. So yes, again, you're encouraging whatever system, again, works best for you to gather the information. And because Google Forms can be shared, they can be worked on all at the same time from different users. That's a great tool to use. And I'm going to back up just real quick about the principal. So the issue, and this would go really for any group that you're really trying to gather information from. So if school principals, for example, is a group that you really need information from, go to where they are. They meet, they usually meet on a monthly basis, maybe every couple of weeks or every other month or something. So get on their agenda, and now you have kind of a captive audience that you can take 5 or 10 minutes, hopefully. I know they're very busy people, but then that's maybe a great way that you can go ahead and capture information quickly and briefly. You okay, Marianne? Should I keep going?
Yeah, I think I'm just not used to talking this much, so my voice is tired. Okay, so yeah, I think you answered these questions beautifully, Mike. Thank you. Okay, so those are the questions you received in advance. Please go ahead and type any questions that you have about component 3 into the chat box so that we can answer them.
We got a couple already. So Jane says, use your administration, engage your superintendent. So again, this kind of comes back to how do you get the ears and voices from folks all the way up and down the school water column. Start at the top. Sometimes that works very well.
Okay, so it looks like the first question we had is, if our wellness policy has specific goals in the language, can we use these goals versus creating new ones with the wellness committee? Absolutely, Carolyn. And I'm sorry if that wasn't super clear. If you already have goals established, please use those and use those to measure your progress. The recommendation of creating new ones is if you don't already have goals in your wellness policy, we recommend creating them. But if you have them already, yes, definitely use those for your assessment. The next question is, do you require a minimum number of meetings with the wellness committee? And I'm going to let Mike answer that.
There is no requirement for the number of times that the wellness committee needs to meet. But again, if you kind of think about this of getting work done, We've kind of said if you're meeting less than 4 times a year, it's probably very difficult to get anything done. If you're meeting 4 times a year, it's still, it's probably you're still able to keep up on things. But if you in your action plans, or if your plans are to implement a certain piece of or one of the goals in a particular time, you may need to meet more times than not, or you may need to create subcommittees, if need be. So again, hard for us to say how many times you do need to meet and when, but think those ideas through about where are your implementation pieces, when do they need to occur, when are your evaluation pieces, when do those need to occur, and that will help you kind of set your meeting agenda.
Okay, the next question is, my concern getting feedback from parents is that our published report may say that a school is not in compliance, and then the school administration may have a different view. What is your recommendation when writing our report?
Great question. And what you might want to do is kind of go through various channels before that. And so you may want to get, put your report together and bring it through your district administration first, and maybe even your school board first. And maybe they can help you determine how best to share the information with your community. But really, ideally, the information should be open to the public in general.
Great. Carissa asked, if our district has used the WellSat before, should we continue to use that, or is it okay to use a different tool?
Good question. Yep. Okay. You can use, if the WellSat, again, it's the idea of if the WellSat has ideas that you still want to continue pursuing, use the WellSat. If you want to kind of look at the Alliance for Healthier Generation and see how they put information in there, you can use that as well. I would think overall, it doesn't really matter at the end of the day, but usually, if you want to use the WellSat this round, and then in the next 3 years, use the Alliance, just to kind of get a different flavor of how the comparisons occur, that's absolutely fine.
Great. And then Ozma mentioned, and sorry we missed this earlier, she said she asked for a template for a district action plan, and there is actually one on the Triennial Assessment webpage. We just need to find the link to it. I'm sorry, let me just find it. I think it might be. You know what? I will find it for you, Ozma, and we'll share it out as part of the resources in our email after this. Yep. Sorry about that. We do have one though, so you're not going to have to start from scratch with that.
No, and in general, really, an action plan is really nothing more than what the goal is, and then providing, who's going to be monitoring or overseeing it, what it is, where it's going to happen, answering the who, what, when, where, why, for each of the various pieces that you want to make sure you either implement or evaluate. Perfect.
Okay, so we'll move on to the last component, component 4, which is the Triennial Assessment report to the public. So the purpose of this component is just to really ensure that the broader school community is aware of the local school wellness policy work and where you are in that work. So it's also an opportunity to recruit new local school wellness policy committee members. So it's a good way to engage new stakeholders. The Triennial Assessment template includes examples of methods for sharing your results and a template for sharing the report to the public, as well as kind of a one-pager that you can complete to share your results broadly. So to complete this template, again, we recommend working with your wellness committee to determine the best approach. So which methods do you want to use to share this broadly? And so we recommend considering how you want to share the information and who you want to share the information with, and that will help you determine the best methods. And we're going to provide some examples of methods to use to share this information more broadly. The next step is to just share the results, and the last is to complete the Triennial Assessment report to the public template, which again is a very simple table that you can share with the Department of Education during your administrative review to show that you completed this component. So the questions that we received, the questions that we received around component 4, the first was, what are your recommendations for sharing this information with the public? And so we just provided some examples, like posting the report to the district or school websites, sharing it in a district newsletter, sharing via social media. Mike, I'm going to have you take over again.
Oh, okay. Could be allergies too. They're starting to kick up. Again, these are various methods for you to be able to share the information out. And again, I think, everybody, you can utilize the websites, the newsletter, social media, again, school board meetings or other types of meetings, and things like that. And then just to kind of circle back with, what information to share. Again, a really great question that was asked earlier. You may want to get input, from your district administration about, how, set it up, and then ask for feedback if they're, if your district is comfortable with how you're planning on sharing information out to the various groups.
Okay, I'm going to try again, but we might need to, I might need to tag you in again. Okay, thank you. The next question is, if districts share the assessment at wellness meetings, is this sufficient in meeting this component? And our answer is that the results of the assessment should really be shared more broadly with the public. So not just at a wellness committee meeting. What you decide to share and how you share the information will really depend on your audience. But we do recommend sharing it more broadly. Anything to add to that, Mike?
Nope.
Okay. All right, so let's have you go ahead and type your questions about component 3 in the chat, and then we'll answer the other questions that you have that we've seen posted so far. So Hannah asked, what are your thoughts on how WellSat organizes and details the requirements of the triennial assessment? I'm particularly interested in your thoughts on their step 3, where they suggest to identify connections between policy and practice as component 3 of the triennial assessment template. Mike, any thoughts?
I'm not as familiar with that detail of WellSat, but it's sounding to me like what they're really trying to encourage wellness committees to do is, again, look at the language and see if it fits into the goals of the district, and if so, add it, and then that would put that information in, and then you'd have to sort of act on that detail and put it into action, make it into practice. I don't know if I'm capturing that correctly. Sorry.
No, I think that was a good answer. And I'm sorry, this should be questions about component 4. I did just want to show you what component 4 looks like in the template. We have the triennial assessment report to the public table. It's very, very simple. It just kind of outlines what you shared and how and when and with who. And then we also have a report template to the public, which is kind of an infographic that's blank that you can complete to add your district specific information. It's kind of a nice little one pager that you can use to share your results with the broader community. Okay, it looks like we have another question, Mike. Is the triennial assessment required to go to the BOE?
I assume that's your school board, your Board of Education?
Yeah, I'm assuming Board of Educators.
So if it's the school board, again, the requirements don't spell out exactly who you need to quote unquote share it with, but if it is the school board, okay, you said yes, school board. They are the ultimate gatekeepers on whether policy language changes. So I would think they are one of the key audiences that you need to reach with your messages. Again, both great messages and messages that you need to have changes to. Because again, if you're going to make changes to your wellness policy language, they are the ones that are going to need to approve it.
Great. Okay, so we're going to move on to just general questions that we received in advance that, aren't specific to one component, but are broad. So we'll do our best to answer these. And then again, any lingering questions that you have, please type them in the chat and we'll answer them at the end. So it is difficult when our school food authority does not receive support and participation on the local school wellness policy. Nutrition is a portion, but there are other facets, including physical education, nutrition, mental health, etc., that are just as important. Our department leads the local school wellness policy, but it is difficult and overwhelming without support from other departments. How do we improve our collaboration efforts? And it's a great question, and we get this a lot, and we know how challenging this can be. So our recommendation is just really aligning your goals with the priorities of the people you're trying to engage. I think social emotional learning and mental health are a really good example of areas where there's already momentum and folks are engaged around that type of work. So wellness policy is a good way to kind of help meet that or just meet those needs and those priorities for people. So we just really recommend being flexible and aligning wellness policy with whatever the priorities are of your key partners, and just really finding your champions and building your momentum from there. And then of course, keeping your superintendent informed and engaged. As Mike mentioned early on, having support from the top is really, really important. Anything to add, Mike?
Yeah, so, kind of in connection with aligning your goals with the priorities of the district, your district has an LCAP, a local control accountability plan, and there's a lot of this that can fit inside your accountability plan. And that's something that already has traction in your district. So again, not only finding the champions who are interested in health and wellness, but finding those programs that you can add the health and wellness pieces into something that's already happening are good ideas.
Great, thanks. Okay, the next question is the county intending to do this on behalf of districts, or are the districts doing this themselves? And the answer is the triennial assessment is typically conducted at the district level, but counties' offices of education may provide support. So I would reach out to your county office of ed to see how they might be able to assist you in this process. Okay, next question was, the WellSat has been used here in the past as our assessment. Will this be done again? And again, as we answered previously, you determine which assessment tool you will use. So you don't have to continue using the WellSat if you find a different tool that works better for you. Okay, so what are districts supposed to input that they use the WellSat tool? And we've already covered this, but just a reminder that the triennial assessment template provides you with forms, the tables to complete this information. Okay, the language surrounding wellness assessments can be interpreted as fat phobic or setting students up for restrictive eating disorders. So how can we incorporate body positivity and get rid of some of the food shame language? We really appreciate this question. And we just want to encourage you all that these tools are not set in stone. So you're welcome to modify assessment tools to include more inclusive or body positive language, or find or create an assessment tool that really better meets your needs. So again, we provide things, recommended tools or tools that we have seen to be successful in the past, but you are by no means required to use those, and you can modify them to meet the needs of your audience. Okay, so that ends the questions we received in advance. Go ahead and type any other questions you have in the chat. It does look like Carolyn was asking if we can show you all how to get to the triennial assessment webpage, and yes, we can. So let's start with, you'll go to healthyeating.org. And Bailey typed it into the chat as well. If we go under our cause and scroll all the way down to our partners and click on that, and then again scroll down, you'll see the California Local School Wellness Policy Collaborative. You can click on that icon and it'll open you up to the California Local School Wellness Policy Collaborative webpage. Again, you're going to scroll down and you'll see there's that kind of icon for the triennial assessment template, and it'll take you to it directly. You can also use the URL healthyeating.org/triennial-assessment-template, I believe. But we'll share that link out as well via email after the webinar today.
Thanks, Marianne. Will you go back one just to kind of highlight some of the other links that are?
Is this what you're looking for?
Yeah, so again, there's the wellness policy resource link. There's the collaborative webinars, which this will become a part of. So there's other things there too.
Yeah, good point. And we have our previously recorded Triennial Assessment webinar, which really takes a deep dive into the template, if you want to look at that. And then other really, really great webinars that the collaborative has hosted this year and in previous years. Okay. Any other lingering questions for the Triennial Assessment? Okay. Hannah said, I noticed that the chart in the example for component 2 shows the results for what looks like 7 questions. Is that the case? The school health index is over 50 questions, so showing results for all 50 questions would be a lot of data. Instead, we were hoping to show the data condensed down into the 8 categories of the school health index. Thoughts? Mike, do you want to answer that one or do you want me to?
I can give it a shot. And again, I think, this information is flexible enough for you to categorize, subcategorize, or combine categories together that make the most sense to you. I think 50 questions is a lot. And again, you may not even want to use all 50 depending, because some of them may not even apply. So I guess that would be my answer.
Yeah, so I think you could condense it down. I did want to note that in the Triennial Assessment template where we looked at the extent of compliance, this is actually organized by the local school wellness policy requirements, so the policy areas. So nutrition education and physical activity have specific requirements. Nutrition education and physical activity, there are specific requirements that are included in the local school wellness policy. And so it's really looking at what you've written in your wellness policy and pulling out what you think makes the most sense. So hopefully that helps. I did want to note too, if you look at the Triennial Assessment template webpage, we do provide at the very top a link to the final rule requirements, which kind of outlines what needs to be included in your policy. And so that table is really aligned with the different requirements outlined in the final rule. So hopefully that makes a little bit more sense. But there aren't specifics, so you can organize that information however makes the most sense for you. And again, the purpose here is to really kind of push the needle and try to advance. So however you do that, whatever works best for you to continue advancing the implementation of wellness policy is really the purpose here. Okay. Any other questions before we wrap up? All right. Okay, well, we wanted to provide our contact information for you so that you can get a hold of us. If you have any questions, please reach out. Again, we'll be sharing this information along with our contact information via email after today's webinar, as well as a recording. And our lovely Bailey has shared a lot of information to sign up for our newsletter, visit our webpage, etc., so that we can continue communicating with you. Awesome. Okay. And so we just wanted to thank you all so much for joining us today and for asking such great questions. We wish you luck in completing your triennial assessment and are available to support you however you need. So thank you again for joining us, and we hope you have a lovely rest of your day.
Great. Yeah, thanks everyone. And yeah, we are here to support as best we can. So thank you.